Hi, I'm going to close the door for privacy and wash my hands for safety. My name is Adriana. I'm going to be your nurse practitioner today. What brings you in?
I just here for a checkup.
Okay, can you tell me your name, your date of birth, and where we are right now?
Yeah, Cat's appointment, May 5th, 1995, and we're at the Tamarack Urgent Care.
Okay, awesome. Also, can you tell me, have you had any coughs or chest pain or shortness of breath?
No, I haven't.
None of the three? Okay. Also, do you have any history of heart attack?
Nope.
Any diabetes?
Nope.
Cholesterol issues?
Nope.
Okay. So today I'm going to be doing a focused cardiac assessment for you, if that's okay with you.
Okay.
So with this, I'm going to start by checking your jugular venous pressure. I'm going to have you turn your head, and I'm going to be assessing for jugular venous distension and pulsation. So here I shouldn't see any distension with you because that's a sign of fluid overload and you don't have that. So I'm going to take my pen light and I'm going to assess for oscillation here. I'm also going to take my ruler to assess for JVD. I'm going to put it at the angle of Louis. It's going to be perpendicular, parallel to the wall. And then I'm going to have my pen perpendicular to the oscillation. With this information, I'm going to get a number, centimeters. And if it's less than 3 centimeters laying flat, it's normal. And since she's at 30 degrees, I'm going to add 5 centimeters to that. If it's less than 8 centimeters, that's normal as well. Here, I'm also going to be inspecting your carotid and palpating your carotid as well. Okay, so just look forward. I'm going to palpate one and then the other. I'm also going to listen for a bruit with the bell of my stethoscope. Okay. So for her, I don't hear any bruits because this is a normal finding. And now I'm going to start to inspect her chest and her pericardium. So for chest, I'm looking at the shape, the symmetry with symmetrical, and I'm going to check for pulsations, heaves, or lifting. Now I'm going to be assessing for your apical impulse. This is going to be your point of maximal impulse. This is located at your left midclavicular 5th intercostal space. Sometimes this can be hard to palpate, so I could have her turn to her left side, left decubital, and I can have her exhale and hold. And while she's exhaling and holding, I would be doing the same. And the size of this is less than 2.5 centimeters, which is roughly 1 intercostal space, or the size of a quarter, for reference. And I'm also going to be assessing right now for your heart sounds. I'm going to be using the diaphragm of my stethoscope. I'm going to be listening for your aortic valve at the right sternal border, 2nd intercostal space. Your pulmonic valve is the 2nd intercostal space, left sternal border. Your tricuspid valve is the 4th intercostal space, left sternal border. And your mitral valve is your 5th intercostal space, left midclavicular line. I'm also assessing for the rate. This is at the apical line, the midclavicular 5th, around the 5th intercostal space. And I'm also going to be assessing for the rhythm. For her, the rhythm is normal, but for some individuals, a sinus arrhythmia can be found. I'm going to auscultate for murmurs. With murmurs, it can either be stenotic or regurgitation. With stenosis, there's going to be a difficulty with the opening of the valve. And with regurgitation, there's difficulty and issues with the closing of the valve. I'm also going to grade them on a 6-point scale. So 6 is from 4 and up. You're going to hear, I'm going to feel a thrill along with the murmurs. And the most common murmurs which are heard on the left side are mitral stenosis, mitral regurgitation, and aortic stenosis. Okay, so now I'm going to assess your peripheral vascular system. So can you tell me, have you noticed any edema?
No.
Have you had any ulceration?
No.
Intermittent claudication,
No.
pains with walking? Okay, so now I'm going to be assessing her upper extremities. So I'm checking her color, her skin color, which is congruent with ethnicity. I'm checking for any lesions. She does not have any. I'm checking her skin turgor, which is elastic and brisk. I'm checking her capillary refill, which is less than 1 to 2 seconds. I'm going to check for clubbing. She's going to put her fingernails together, and I'm going to see a small diamond shape, which is normal, which is no sign of clubbing. Now I'm going to assess her radial pulse, which is lateral, and this is going to be 2. So 0 is no pulse, 1 is thready, 2 is normal, 3 is bounding, and 4 is aneurysmal. And then I'm going to assess her brachial pulse. And I can do this bilaterally as well. Now I'm going to do the Allen test. This is assessing her radial and ulnar arteries. So I'm going to have her make a fist. I'm going to occlude both arteries. I'm going to have her open her hand. I'm going to release one hand, and it's going to be a quick blood flow return. I'm going to have her do it again, but remove the other hand. Same thing with the other hand as well. So now I'm going to assess her lower extremities. So I'm checking her skin color, which is congruent with ethnicity. I'm checking for edema, which I do not see. I'm assessing for any lesions or skin discoloration, which I don't see as well. I'm going to assess for capillary refill, so I'm going to squeeze her toe and see the cap refill is less than 1 to 2 seconds, which is normal. I'm also going to see that with edema, if she did have it, if she had 1 plus edema, it would be 2 millimeters. 2 plus edema is 4 millimeters. 3 plus edema is 6 millimeters. And 4 plus edema is 8 millimeters, and all of this is abnormal. I'm going to palpate her pulses. So I'm going to start with the femoral pulse up here, the popliteal pulse behind the knee. I'll check with both hands, the posterior tibialis, and the dorsalis pedis. Okay, so now I'm going to assess her calf symmetry. So from the tibial tuberosity, I'm going to go down about 10 centimeters and then put a tape measure around her calf, and then I would assess on the other calf as well, and it should be less than 1 centimeter difference. I'm also going to assess the Holman sign, which is to check for any DVT possibility. So I would lift this leg and dorsiflex her foot, and if she had pain, it's just a possible indicator of a DVT. And then now I'm going to have her do the Trendelenburg test. This is testing for her valve function and venous blood return. So I'd have her lay flat and lift one affected leg if she did have an affected leg. I would tie a tourniquet around her leg, and then I would have her stand up. What should happen is that her blood return should be slow with the tourniquet on, which means her valves are working. And then when I remove the tourniquet, her blood return should still be slow. Now I'm going to assess your ankle brachial index. With this, I'm going to take 2 systolic blood pressure readings on the right arm and average that. Do the same for the left. That's the denominator. Then I'm going to take my Doppler and I'm going to assess 2 systolic blood pressures on the right. Take the average of that, and that's the denominator. That's the numerator for the right. And do the same for the left. That's the numerator for the left. For the result that's greater than 0.9, this is normal, but a result less than 0.39 is considered abnormal. It's a strong indicator for peripheral vascular disease, and anything in between is mild to moderate disease. Okay, thank you for your time. I hope that you learned from this, and I hope that I'm able to help you in the future.